You've probably heard about endometriosis, but have you heard about adenomyosis? Adenomyosis is endometriosis' less well-known cousin. I'm Dr. Jessica Reinick. I'm a double board certified OBGYN and reproductive endocrinology and infertility specialist, and we're going to talk about adenomyosis. Adenomyosis is similar to endometriosis in that tissue similar to the lining of the uterus or the endometrium grows somewhere that it shouldn't. So endometriosis is when tissue similar to the lining of the uterus grows outside of the uterus. Adenomyosis is when tissue similar to the lining of the uterus grows into the muscle of the uterus. The problem with this is that the tissue that is now inside the muscle of the uterus can still kind of grow and shed in relation to the hormones of the menstrual cycle. This can cause pain, it can cause swelling, and it can cause really heavy bleeding as well as inflammation. The exact cause of adenomyosis is not really well known, but we do know that there are some things that are associated with a higher likelihood of having adenomyosis, and that's having had multiple pregnancies, uterine surgery like a myomectomy, removal of a fibroid, or even a cesarean section. An abnormally high estrogen can sometimes cause this endometrial tissue to grow inappropriately, and there's also potentially genetic. So how do we diagnose adenomyosis? One can be suggested on a physical exam. So if the uterus feels enlarged and tender, we can also do ultrasound and an MRI of the pelvis. The only way to fully diagnose adenomyosis, kind of similar to endometriosis, is surgery and removal of the uterus to look at it on pathology. Why does a fertility doctor care about this? So adenomyosis can have impacts on fertility, fertility treatment, and pregnancy outcomes. When it comes to fertility, the thought is that the enlarged and inflamed tissue can impact implantation either through inflammation itself or alteration in the ability of the lining to implant an embryo, or what we call altered receptivity, sometimes thought to be through progesterone resistance. It also may alter the way that the uterus and fallopian tubes contract. It can cause an altered chemical environment and a thinner lining. So there are a number of different ways that adenomyosis may impair fertility. It also can lower success of fertility treatment. Adenomyosis causes reduced implantation, pregnancy, and live birth rates. Unfortunately, those that get pregnant with adenomyosis are also not completely out of the woods. Adenomyosis is sometimes associated with pregnancy loss and recurrent pregnancy loss, and even later pregnancy complications such as preterm labor, placental insufficiency, and increased pain throughout pregnancy. What about treatment for adenomyosis? So the treatment for adenomyosis is many things, depends on what your goal is. And so if the goal is management of pain, heavy menstrual bleeding, that might be a different pathway than what the treatment goals are for someone who wants to conceive. And so specifically for someone who wants to conceive, the treatment options often end up including IVF with hormonal suppression prior to an embryo transfer. And there is evidence that there can be a benefit of this medical treatment and hormonal suppression prior to pregnancy. While adenomyosis can be a challenging and frustrating condition to diagnose, treat, and especially live with, there are definitely treatment options that can help to manage your symptoms, alleviate your pain and heavy bleeding. And if the goal is to become pregnant, there are treatment options that can help improve your chances with that as well.